Welcome back. I'm here now with Dr. Deborah Manjoney from the Wisconsin Vein Center and MediSpa. Today we're going to be talking about a condition that's called deep vein thrombosis, or DVT. Good morning to you.
Good morning.
Nice to see you.
Thanks, it's nice to be back.
So DVT, right. What is it? We just said it's deep vein thrombosis.
Now thrombosis is a clot.
Okay.
So what we're talking about is a clot that forms in a major vein, usually in the leg, and these major veins are underneath the muscles, and that's why we call them deep veins. And if a clot forms there, it's obstructing blood return back to the heart. But the bigger problem is what can happen to that clot, and it can break loose and travel all the way back to the heart and into the lungs and cause a problem with the blood supply to the lung.
Okay.
And that's called a pulmonary embolism.
And that's serious.
That's very serious. That's the leading cause of death, preventable death in hospitalized patients.
Really?
Yes.
The #1 leading cause of preventable death in hospital patients. Interesting. Deep vein thrombosis then is different than some of the vein problems that we frequently talk about on the show, because some of the problems we talked about before are more superficial in nature, where this is really a medical condition,
This is a medical condition that needs to be treated appropriately with blood thinners. And that might even involve using the clot busters that we use, you know, when somebody's having a heart attack and they're given a clot buster. We might have to do that even for this kind of thing, for deep venous thrombosis. But the big thing is that people need to be aware of it, that it's an important problem that occurs out in the public, not just in a hospital setting, because there are several things that make it more likely to occur.
And what causes it?
The things that cause a DVT, or deep venous thrombosis, are basically in 3 categories. One is immobility. So if somebody's not moving around, if they're in a tight seated situation, if they're not moving, if they're hospitalized, if they've just had surgery, if they're pregnant, all these things mean that we're moving around less and less. And so that's one issue. The second one would be hypercoagulability, which means the blood is more likely to clot. It can be a little thicker, or there can be a hereditary problem that means that the person might have a little bit more of a tendency to form a blood clot. And the third thing could be if there's an injury to the vein or to the leg from trauma. One of those 3 things usually is an initiation of this process, which leads to clotting within the blood system when the blood is supposed to be running freely.
Okay. Is there usually pain associated with deep vein thrombosis?
There often is pain, but not always. And that's one of the problems in diagnosing this. And that's why we know that there's a lot more silent DVT than comes to the public awareness, and that's why there are so many deaths that can occur when a piece of this clot breaks off and goes to the lung, because somebody doesn't know they have the DVT to start with. We see that in travelers quite a bit.
Okay.
So somebody who's on a long flight or who's in a car for a long period of time, and they're not moving around, or they fall asleep and just stay in one position on the plane, and then they may not know that they've developed a DVT. But a DVT, if it's going to have symptoms, you will see somebody have a swollen leg. Frequently they have pain, not often tenderness, but pain in the leg. And some people just blow it off. They think, oh, it's just a muscle ache or something. But when they have swelling, especially with it being only in one leg and not both, that's an indication they need to have medical attention very quickly.
Okay, in one leg rather than both of the legs. Okay. And what about, you mentioned that diagnosing it can sometimes be tricky. How is it generally diagnosed?
Well, the way that we diagnose deep venous thrombosis is actually with ultrasound, like we do in our office to diagnose our,
and most
superficial
people
vein disease.
Are familiar with ultrasound when they're pregnant.
It's a painless procedure where we use a probe that we pass over the limb, and we're able to make the diagnosis of the clots in the leg. However, they may also need additional studies to look for clots in the lung if it's a suspicion and a high enough suspicion. Plus, there are some blood tests that really help guide us to whether or not this has occurred.
In terms of treatment, you mentioned blood thinners or clot busters. What else can be used to treat DVT?
If somebody has a DVT with the leg vein involved, they certainly should be in graduated compression hose stocking, the elastic stockings. And nowadays, we get people up and walking around, which we didn't used to do until just a few years ago. We thought DVT had to be treated in a hospital with somebody at complete bed rest on blood thinner, heparin. Nowadays, we're using the injectable subcutaneous types of low molecular weight heparin, and we're getting people up and moving right away, and then putting them on a long-acting blood thinner by mouth that they'll have to be on for several months.
That's key, I would think. What about varicose veins? We've talked about that frequently.
Yes.
Do they have a relationship to DVT?
They actually do. Somebody who has varicose vein disease is a little bit more likely to get a DVT, and one of the reasons that that can happen is that these varicose veins can be very large, And the superficial vein trunk that the varicose vein is coming from can actually, in all cases, join into the deep vein at the groin. And so if a clot forms in this superficial vein and propagates or continues to grow all the way up, it can get into the deep venous system. Plus, a clot can break off in a big superficial vein and actually travel also because the valves aren't working in those veins, so it can get into the deep system.
And that's why it's important, I think, for someone to have this looked at. Again, because varicose veins can lead to DVT, which is an important thing. You treat veins at the Wisconsin Vein Center and MediSpa. And for more information, people can contact your office. It's 262-746-9088. The website is WIMedispa.com. Again, WIMedispa.com. Important information.
And we will have a newsletter really devoted to DVT that's going to be available on our website by this afternoon.
Great. Okay, good information there. And again, that website is WIMedispa.com. Thank you so much.
Thank you.
After the break,